being an orthopedic surgeon for almost 30 years, I've had patients ask me about collagen for a long time. And what I would always tell them is, if it works, great. If it doesn't work, don't waste your money. But the biggest problem was this was all powdered collagen. So powdered collagen is only absorbed by 20%. So if they're taking 4 or 5 scoops and they're getting 15 grams of collagen ingested, they're only getting about 3 grams absorbed. Where our product's different is it's 10 grams and it's about 95% absorbed because it's a liquid. So they're getting all of it. And this is truly, in 30 years of orthopedics, it's truly the only product that I have found that actually will reduce joint pain.
You were talking about chondroitin, you were talking about, what are some of the other products that people had?
Well, so, I mean, when we're dealing with people with joint pain, I think the first two are going to be the liquid collagen and the Protandim NRF2. We have to lower oxidative stress. Oxidative stress is probably the cause of all major diseases. Once we get, and the problem right now is all the ultra-high processed food. Ultra-high processed food has significant oxidative stress. That oxidative stress leads to free radicals. The free radicals attack our metabolic system, so it lowers testosterone, estrogen, thyroxine, human growth hormone. As we lower those, we start putting weight on. We also lower our GLP-1 levels. So now it comes into the obesity issue. So unless we can activate all of those pathways, we're doomed. We are truly doomed because there's no way to get rid of the weight. I've been a big guy all my life. I've just lost 65 pounds on the mind-body GLP-1 since October. But the problem is we have not been able to have a way to keep GLP-1 levels elevated. If we talk about the injectables will elevate it really high for a week and then they drop off. And when you go off of them, NIH just published their study. The NIH said that in the first year after going off the injectables, 90% of the people regained 66% of their weight. So Big Pharma is not interested in our health. Big Pharma is just adding into the yo-yo dieting culture. Because now we're going to be on it for a year, we're going to be off of it, we're going to gain our weight back, we're going to be on it, we're going to be off of it again, and it's just going to keep going. It's a vicious cycle. I think with the mind-body product, now we have something that can sustain elevated GLP-1 levels, and as we heard today, up to 200%.
Wow.
So now we have a way to truly treat someone's arthritis, because we're down-regulating the stress on the joints because our weight's coming off, and we're up-regulating the hormones, so we're feeling better. And then with the liquid collagen, we're rebuilding the collagen in the joints.
Thank you. That's great. Thank you.